Hello and welcome to the NewsX Sunday Garden Roundtable. Well, today we shall be taking a break from discussing Afghanistan and actually focus on another big issue that has been worrying all of us all this while, which is, of course, the rise of COVID, impending third wave. How serious will it be? Because we are living in a COVID continuous world. In fact, as of now, the data shows there were about 32,000 cases recorded in an average in the last 7 days. Cases are falling, but does that mean that the third wave will not happen? Will it not be as serious? And where are we on the vaccination front? There've been some kind of worry that, have the vaccinations efficacy reduced? Should we mix and match the vaccination? Should we take a booster third dose? To discuss all that with me, I have joining me a panel of experts. I have Dr. Harsh Mahajan. He is the founder and chief radiologist at Mahajan Imaging. Professor Dr. Sanjeev Bagai, he's the chairman at Nephron, and also he's a Padma Shri awardee. And Dr. Rommel, he is, of course, the director of internal medicine at Max Hospital. Dr. Martin, you and I were discussing before the show began, is this third wave, what to expect from the third wave? Is it going to be as serious? We've heard the National Institute of Disaster Management saying that it could happen sometime between September and October, and that's got everybody worried. So what are you hearing?
Well, Priya, the third wave really depends on our behavior as citizens of this country. Because right now, as you can see, we are at around 30,000 cases, and these are concentrated in a few states. And even if we look at Kerala, which has the maximum numbers, the cases in the last week have come down. So we hope that with COVID appropriate behavior, with increasing vaccination, these cases would continue to come down. But if we look at the vaccination itself, even though we vaccinated more than any other country in the world, save China, but still, if we look at our population, the percentages are very less. We have reached about 6 million doses a day, which we are able to do. The target now has to be 10 million a day. And once we have the vaccines, probably we would be able to do it. But there are still a lot of unvaccinated people out there. However, if we look at the ICMR survey, which was done across the country, it says that about 65 to 70% of the population is seropositive, meaning has had some exposure to the virus, and as even 75% in certain geographical areas. Kerala, as per that survey, was at 40%. And we've seen, the surge that happened in the last month and a half in Kerala. So if we believe this sero survey, and this also includes children, of all ages, then one would say that we are in a good position. If the vaccination numbers can be ramped up, and if we can achieve the target of vaccinating the entire adult population by end of the year, seems implausible. Maybe by March, we may be able to do it. Then we would have to really attempt to create a third wave. And if the third wave does come, which it will, maybe this number of 30,000 may go up to 90,000, a lakh. But frankly, the number of 5 or 6 lakhs a day that has been touted seems unlikely, unless, of course, we have a different mutation occurring, a new virus taking over, and then you don't know. Because if it is more infective than the Delta virus, then, you can't say what will happen.
God help us, yeah.
India has already been through the Delta virus, and we hope that if this is what persists, the numbers would not be very large.
Dr. I take the last parts of his question. Will the third wave also, will it mutate into something more deadly or something, considering that there is some kind of an immunity being built, there's some kind of vaccination happening. Are we going to be in for another severe attack, or are you more hopeful?
Hi. So just concentrating on the next surge, so to say, I think the wave scares everyone with the stigma. I think it may actually merge with the downslope of the second wave, which is still continuing in many states in India. Now, if you look statistically, as per today, we are nearing about 60 crore vaccines, one shot and fully vaccinated put together. And if you look at the Indian population of 138 crores, and even if you look at an optimistic figure of 80% of the Indian population being vaccinated, and not counting the children because they have not been approved as yet, you're looking at about 90 crores into two shots. That is two shots each, which is about 180 to 185, or say maximum 190 crore injections. We finished 60. The couple of important points in this is that we have a population which have already been infected, which is nearing about 4 crores. Most international data shows that for every positive patient, there are approximately 9.5 to 10 asymptomatic carriers who had mild infection of the same viral load, but not actually tested positive or not clinically manifested. Now, if you look at that into account, more than 35 crore Indian population would have actually been subjected to or had a transient asymptomatic attack or a mild attack, which was never tested. Keeping in mind 60 crore vaccination and another 35 crore, we're almost half the way done. So I think there is some amount of what we call as community acquired immunity, which is already setting in, that's for sure. And the other basis for being a little bit more optimistic, but not putting our guard down is four important points. One is the old infections of the coronavirus, which includes the SARS and things almost 20 years back, is now giving a cross-body immunity to the present SARS-CoV-2. The second point is there is something which is called as common cold coronaviruses, which we call as hybrid immunity. So there is a crosstalk amongst tissues, which gives you a very good robust immunity even to this SARS-CoV-2. And third is there is something which we call as a memory response, which is not only B cell, but mainly the T cells, the T regulatory cells, which no one is actually talking of because it's not really measured and difficult to measure. This gives a very long lasting and a memory immunity, because that's your reserve, that's your data bank to identify a past exposure and host an immune response. So I'm reasonably sure that the third wave may actually merge with the downslope of the second surge, and it will distinctly be a lot milder. The vaccine is going to now drive another, say, 15 or 20 crores in the next month, if not more. So we would be in a reasonably good position, keeping in mind that the masks are equally as important as the vaccine.
Good point. Dr. Tickoo, take from the vaccination point of view. We've also heard the efficacy of vaccinations is reducing. Some people are saying we need a third dose. Where do you stand on that? What do you feel?
Well, there's not enough data to say that, but yes, the efficacy of the vaccines does wane over a period of time. In fact, there is data which says after 1 month only, the levels of antibodies do drop. That's the Oxford, the UK study. And we do know that because now if you look at US and if you look at Israel, the kind of infections, the surge which is happening, post a phase where they thought that it's all done and dusted, they stopped wearing masks. And now you have 1.4 million cases a day in US with 1,000 deaths happening. And half the population is vaccinated, actually. So why is that happening? Or if you look at Israel, the first country to be so aggressive with vaccination, and almost hardly any cases post that. And now again, there's a surge. They've again started wearing masks indoors. And again, because the vaccine doesn't give you protection for long, it might give it to you for 6 months, but after that, the antibody levels drop. There is more to immunity than antibodies, the T cell and all that. But yes, you might need a booster at some point. Now, why the WHO says is you should not get into that booster thing right now is because we get their point that majority of the population all over the world in poor countries haven't even received a single shot. So instead of giving a third shot to somebody, why don't we give one shot to somebody who hasn't even had it? So that does make sense. But now there's emerging data which says that the booster doses help to increase the protection. So that's what now US is doing. Post 8 months now, they're giving boosters to everybody, post 8 months of the second dose. And Israel started with 60 and above, now they've gone to 40, and at least 5 months from the second dose. And I think that does make sense, especially with the vulnerable population, because they're at a higher risk. And at some point, maybe, see, as our other panelists said, both the doctors said, see, we have to be very aggressive with vaccination, but it is a humongous task. 1.38 billion people. I mean, you have to give it to them the way they are doing it. Even we did 88 lakhs the other day, and now we are at 60 lakhs a day, which is not a small number. But yes, it is difficult. We have to keep at it. We have to be very aggressive.
One
because
quick question,
vaccination.
Dr. Tickoo, the cases that you're getting now, how serious are they? Are they like the cases in April, or the infection less severe? What kind of cases are coming to you now?
Where are the cases? There are,
Oh, that's good news.
hardly
32,000 cases. I heard.
not in
Delhi's-
Delhi, not in Delhi. We're seeing some 20, 30, 40 cases a day. So we hardly see any COVID. As of now, things are much, much better, almost back to normal. If you go to the market, look at the people. I mean, you know, everything is back to normal. People have forgotten what happened in the second wave. I mean, even now people are not wearing a mask. But you look at US and Israel, I'm giving you that example. So how can we be different? Because we have 67% seroprevalence? That's not making any sense. I mean, we can go through it all over again. Keep following the code appropriate behavior, and vaccination. Vaccination is the key. And at some point, probably we'll need a booster also. Maybe not at this point. Maybe it's not practical at this point of time. But yes, we'll have to at some point.
That's what I want to ask you, Dr. Mahajan. When will we have enough vaccinations? When do you see the India being, you know, we've heard that new vaccinations are coming, one for even 12 plus children, Zydus Catalyst is coming up with. Where are we on the vaccination front? Today, there's no shortage, or is there still a shortage?
I don't think there's a shortage any longer. Only thing is our population is so huge that 6 million, as Dr. Tickoo said, which we are achieving every day or more, is a huge number, but we need even more. But I don't think anyone is complaining right now that they are sitting free, don't have the vaccine, and that's why they are not able to vaccinate more people. But certainly, I think if we were to have a bigger supply, probably we would go down the supply chain and reach the last mile, which I think the rural areas, the distant areas still need more of vaccination, and probably the single doctor clinics in the rural areas may come into play. And there is some discussion that in the private sector also, the government may be starting to supply vaccine to these small nursing homes, to these single doctor clinics, who can also then contribute to the entire effort, because they don't have the wherewithal to actually put money up front and buy a large number of vaccines and store them. If the government were to supply, and there is talk that this may happen.
Good news. Dr. Bagai, before I heard you talking in other shows, the importance of a mask, and you spoke about it now also. I'm going to take a break and ask you why exactly you said that, because you spoke about some residual infection being left in the nasal cavity and the dangers of that. But after a quick break, I'm going to come back and ask Dr. Bagai to answer this question. Hello and welcome back to the NewsX Sunday Garden Roundtable. We are, of course, here discussing COVID, the possibility of a third wave. Do we need a booster shot? How long are the vaccinations remain efficacious? Dr. Bhatt, before the break, I wanted to ask you about the importance of wearing masks and why you should continue wearing it, even though you feel that the person has been cured of COVID and there is no such danger.
The most important critical weapon which we have, and it's almost free of cost, literally, because it's so reasonably priced, is a mask. Now, ill-fitting mask is not a mask, and not covering your nose is no mask at all. It's extremely annoying that when educated people walk around as a fashion statement, whether it dangling above your nose or well below your chin, it doesn't make sense. So there are 4 major studies which have proven in international journals, peer-reviewed journals, and the facts are as follows: that the Delta variant transmits maximum in -2 to +3 days of the infection. That means in your first 1.8 days, 78% of the transmission is already done, and that is through the nasal passage. That means when you breathe or in your normal activity of life. So it's extremely important to cover your nose. Point number 2 is that in spite of a double vaccination, 68% of people who are testing positive harbor this infection in the nasal cavity. So it's extremely important, again, to cover your nose. Point number 3, the RNA anemia, that means your load of your virus is almost 80% as comparison to your oral load in the nose. And last, most importantly, is your response of your mucosal response, what we call as IgA, inclusive of IgG and IgM, is maximized from your nasal passage. So please wear a mask. It should be a well-fitting mask. The design and the shape can vary, but it should cover your nose and your mouth in completion. Any child more than the age of 3 should be encouraged to wear a mask. And in my own practice, most kids have found it, have fitted in beautifully into a mask. But the advice is that we need pediatric size masks because 40% of the Indian population is pediatric. So we need maybe another dimension of the sizes of masks. But masks are very critical. Handling of the mask and disposal of the mask is also extremely important. And do not think that if you've got 2 vaccines, that you're over and done with. If you're stepping out or if you're coming anywhere close to anyone, please wear a mask. 1% of any person in a community can precipitate 99% of the other infections, what we call as silent super spreaders. So we are going back to the basics. Vaccines will save lives. Masks is something in your own hand.
Thank you. That's a good one. Dr. Tickoo, but how is there any way of checking the efficacy of vaccinations? I know a lot of people are getting antibody tests done. Some people are saying I took a co-vaccine, but uske baad whichever vaccination, and uske baad there were no antibodies. So is there is there a rule for it? Some rule, something?
See, the only way to do that is checking antibodies. Antibodies are not the only thing which tell us about how well protected you are. So I would not recommend checking antibodies. We don't ask our patients to do that, and it doesn't make sense. Even if your antibodies are low, doesn't mean that you are not having any protection at all. There's a lot to do with immunity, your T cells and things like that. So let's not get into this checking antibody that yours is less than mine or mine is more than yours. So it doesn't make sense. The bottom line is you have to get vaccinated. And again, which vaccine is not important. Whichever one you're getting, whether it's Sputnik, whether it's Covishield, Covaxin, doesn't matter. Now we have more and more vaccines coming in. So at some point, maybe we'll have Moderna, Johnson & Johnson. And the biggest positive has been for children, our own indigenous vaccine, the Zyco. And that is like a huge boost at this point of time. We have to applaud our researchers, our scientists who come up with the vaccine for the adolescent children. And at some point, life has to get back to normal. We have to open the schools. Parents are panicking. They don't want to send children to the schools. So at this point, if we have this and sooner there'll be a rollout happening, I think this will be a big boost to our vaccination drive, children. And later on in the year, by the end of the year, if we have the Bharat Biotech vaccine for children, which is basically for 2 years and above. And then we cover that 40% population, which Dr. Bagai was talking about, because that's also a huge chunk of our population. At the rate that we are going right now, we might be able to achieve 70 crores by the end of the year, but then it might have to be extended till, say, March. By then, maybe we'll be able to achieve that 100 crore target. But at the same time, we also have to vaccinate the children. So it is a humongous task, but yes, we do have to vaccinate each and every person. And I think that's the need of the day. And coming to your questions about the third wave, I agree with both the panelists that it might happen, it might not happen. The mathematical models say that it will happen, but actually nobody can predict that. If there's a mutation happening, and then if we don't follow a COVID-appropriate behavior and we get complacent the way we did, then we are in for trouble. But mind you, even now, there are 25, 30,000 cases a day. The last couple of days, we've had a drastic fall in the numbers. But before 15th of Feb, when the second wave started, the numbers were hardly there. We are much ahead of that even now, 25, 30,000. So we are in the middle of a second wave. And the only way we can prevent ourselves from getting infected is vaccination. And now there's a talk of booster, as you rightly said. And we also have to ramp up basically why they're saying is, saying that a third wave will come, because we have to be proactive. We were not proactive after the first wave. We thought it's all done and dusted and we were just rejoicing that we've done well. But we have to learn from the mistakes of the other countries. Look at, as I said earlier, US, UK, Israel, they've all, Europe, they've all gone through it. So we have to be proactive. We have to ramp up the infrastructure, especially with children, because you don't have too many ICU beds in India for children. And then if too many children get, the worst case scenario, if too many children get infected at the same time, then we are in for trouble. So then again, the shortage of oxygen, shortage of drugs, ICU beds, you don't want to get into that phase. So that's why we should be proactive. We should ramp up the infrastructure, be aggressive with vaccination. And at some point, if there's enough data about the booster dose, yes, we will need it. And again, the mixing
For the data, I think we need the supply. But Dr. Mahajan, where are you on the mix and matching of mixing and matching of what are the right phrases of the vaccinations? Mixing the doses.
Yeah, Priya, it's been shown that when you mix vaccines, the overall immune response is shown to be better. There's studies that have been predominantly conducted in UK, where after Oxford AstraZeneca vaccine, they gave Pfizer, and it gave a much better immune response as compared to 2 doses of Covishield. Similarly, other vaccine combinations have been tried, even Covishield and Covaxin. It is said, we did have this incident in UP where, by, mistake, about 20 people were given Covaxin as the second injection instead of Covishield, which they had received as the first injection. And 18 of them were followed up later. And the immune response that we got was better than what you get with the 2 doses of either of the vaccines. So there is a role of mixing the vaccines, and data, at least for the indigenous vaccines, is still too small. 18 is hardly a number, but serendipity, and maybe this can show us the way. A larger trial has already been started, and we will have more data on this. But wherever this has been, this mix and match has been tried, it does work out to be better. But most important, you need to have the doses with you to be able to, inject.
All come back to that big supply question. Dr. Bagai, your take on the mix and match.
So I think the philosophy is good. If you mix 2 platforms, much will depend upon what kind of doses you use, because even now the mRNA and the mainly the Pfizer and the AstraZeneca have been tried. It's shown a 6-fold increase in what we call as the anti-spike IgG antibodies, and plus it stimulates your T cells much better than your homogeneous vaccine. So the heterogeneous vaccines, which is mix and match, multiple studies from UK and from Spain, even in US. So I think the philosophy is good, but the question is now our main attention should be on vaccinating first shot and the second shot as many number of people in India as possible. With regards to the third dose, just to touch on it, although it's been briefly touched by both the previous panelists, Israel is, as per this evening, finished 1.7 million doses of the third booster. That's the largest number of third boosters. And their own data and the US data actually shows that the mRNA vaccines, which were given at either 3 weeks or 4 weeks interval, the interval was actually too short. So you've not allowed your body's immune response to flower and mature and nurture the proper response, because you gave the second dose perhaps too early. But all the same, they have started now from across all age groups. They had initially kept it for the immunocompromised and the aged above 80, blood cancer, solid organ tumors, chemotherapy, biological agents, and so on, because they are extremely clinically vulnerable. But I think they finished the largest. US has also now started. But I'm a firm believer that since most of our vaccines in India are either Covishield or Covaxin, which have a more than 4-week gap, we would be in a much better position. Perhaps we won't need the third booster, so to say. It's important that most people tend to forget is your immune response is biphasic. So it's a camelback. It has 2 humps. It's a question of when you give the second shot. If you give it on the downstroke, you're not going to get much. So you have to ride the wave much like a surf wave to initiate or enhance the immune response. So I'm quite sure we won't need the third dose in India per se. And I'm quite reasonably sure by end December, we would vaccinate the golden figure to kind of achieve a reasonable protection of community-acquired immunity.
On that note, thank you so much, all of you, for joining us, and stay safe. And hopefully we'll be meeting again on a much happier note sooner rather than later. Thank you so much for this conversation.
Thank you. Thank you. Thank you.